Hello, hello, welcome back to Advanced Human Gross Anatomy. Today's dissection number 23 this is a pretty extensive dissection. We'll be looking at the area under the jaw on the side of the head, particularly the pterygopalatine fossa and the subtemporal or infratemporal fossa. In order to look at these areas, though, we'll be removing the ramus of the mandible, and this will help reveal the branches of the external carotid that we didn't get to really, particularly the maxillary branch and the vessels coming off of it. Also, we'll be looking at the mandibular division of cranial nerve number 5, V3, and the branches that go onto the face there. So let's look underneath the mandible. The first thing we'll see is some musculature here. There's a muscle called the digastric muscle, which di means two, gastric means belly, so a muscle with two different bellies. It comes off of the mastoid process back here on the temporal bone, travels down through a tendinous sling off of the hyoid bone, and then attaching onto the underside of the anterior mandible underneath here. The posterior belly is innervated by the facial nerve, and the anterior belly is innervated by a different nerve, the nerve to the mylohyoid muscle. So we'll see that in a little bit here, where that comes from. There's also a muscle right next to it here called the stylohyoid muscle. So off of the styloid process of the temporal bone, and coming down onto the hyoid bone. So stylohyoid, cleverly named from where it comes from and where it goes to. Now, the mylohyoid muscle, also innervated by the nerve to the mylohyoid, as is the anterior belly of the digastric. This is actually a muscle underneath the stylohyoid and digastric muscle. Has its origin from the mylohyoid line, or the ridge, in the inside of the mandible, on the inside here. And then it inserts onto a midline raphe right between the two anterior bellies of the digastric muscles right here. So kind of on the underside here. Here in this picture, you can also see peeking through the underside of the mandible this mandibular gland right here. This is a salivary gland. It has a duct. Let me find a. We'll see this. Here's maybe a different shot of that. You'll see it's kind of cut here. The mandibular gland has a submandibular duct, or Wharton's duct, it's often called. This is a duct that goes on the inside, empties on the inside of the oral cavity. We'll look at this during a future dissection, but it empties, that submandibular duct coming from the submandibular gland will empty onto the floor of the mouth just behind the anterior incisors back here. We'll see that later on. If we look now to the external carotid, remember the external carotid. Let's just go over these branches again here. So coming up from the external carotid, you have the superior thyroid right here. Off of the superior thyroid is the superior laryngeal. You can see that one ducking into the larynx right there. You've got the ascending pharyngeal off the backside, coming up, ascending to the pharynx. You have the lingual coming up here to the tongue, and the facial artery coming off of that. Next to, right, kind of, you can see the hypoglossal nerve, cranial nerve number 12, kind of exiting over the top of these right there, next to the lingual and the facial. This continues up. Here's the occipital, coming back to the occipital portion, the posterior auricular branch this way, and then here you can see the maxillary branch this way. So today we'll be dissecting, we'll be getting rid of the ramus of the mandible to be able to identify and expose the branches of the maxillary division here, maxillary artery. And then as that continues up, it becomes the superficial temporal artery coming up the sides there. Now, the facial vein, we've seen some of this. Oh, let's just show you this picture here too, so you can see the external carotid here coming up. You can see superior thyroid, superior laryngeal, ascending pharyngeal coming up this way on the back, lingual, facial, occipital, posterior auricular. Here's the maxillary branch that we'll take a good look at today, and then the superficial temporal. So hopefully from a much more complicated picture here. We're showing many more things, but hopefully you can see those branches again that we just talked about. If we go to the facial vein right here, this is an interesting vein. It dumps into the internal jugular. This is going to drain a large plexus. It's going to help drain some of this plexus on the side of the face, this venous plexus, again draining into the internal jugular here. There's also a retromandibular. You can see the mandible has been removed. Here's the retromandibular vein. This is also going to drain into the external jugular, but some of it will help with that drain with that facial vein into the internal jugular as well. So external jugular is going to be outside of the sternocleidomastoid. You can see that's been dissected here. So you can see that. The mylohyoid nerve, if we go here, again, this is the mandibular division of number 5. This is a branch of that. Here you can see it coming down along with the inferior alveolar nerve. Here, it's going to this nerve to the mylohyoid is going to be a branch off of that, innervating the mylohyoid, and you can see the anterior belly of the digastric here. The mandibular division of 5, we'll take a good look at this today, is exiting from the foramen ovale within that pterygopalatine fossa right up on here. So we'll take a good look there. Again, that comes down. There's going to be a few branches here that we'll take a look at, particularly here you can see the inferior alveolar nerve coming off of that, coming down into the mandibular fossa. And that's going to exit as the mental nerve as it goes through the mandible here. But then off of that branch is this nerve to the mylohyoid. Okay, again, we don't have a better name for that. It's just off of the inferior alveolar coming down here. So the nerve to the mylohyoid coming down, also innervating the anterior belly of the digastric, as well as the mylohyoid here. And then the lingual nerve is going to come down and then also innervate the tongue. You can see that branch, that big branch here, coming down, innervating the tongue. And then we'll be able to see these, we'll identify these in a little bit once we remove the ramus of the mandible. If we look now at just some viscera of the neck, just to get our bearings again here of the thyroid gland, which is covering the over the anterior portion of the proximal trachea. 2 big lobes here, connected by an isthmus. But some people, a minority of people, have this pyramidal lobe that actually comes up and reaches towards the thyroid cartilage. You might be able to see that today. There's a few arteries here. The superior thyroid artery, we've already seen the superior thyroid several times here, coming off of the external carotid right there. As that comes down, it's the first branch off the external carotid, giving off that superior laryngeal. You can see that here on each side, superior laryngeal, superior thyroid. There's also an inferior thyroid. Remember, that's that branch off of the thyrocervical trunk coming down here. Remember, thyrocervical trunk, suprascapular, transverse cervical, ascending cervical, and then the inferior thyroid ducking down here. Here's inferior thyroid coming off of thyrocervical trunk, and superior thyroid coming off of external carotid. Venous drainage of the thyroid, there's actually 3. There's a superior coming off of the draining the superior aspect of the thyroid. There's a middle, draining kind of the middle aspect of the thyroid gland. Those both go right into the internal jugular vein, right there. And then there's an inferior thyroid vein right here on each side, and those drain directly into the brachiocephalic veins, coming down into the superior vena cava, directly into the brachiocephalics here. So superior and middle come into the internal jugular, where the inferior thyroid veins drain into the brachiocephalic veins, which is where just proximal to where the internal jugulars enter the subclavian vein, right here. Okay. The vagus nerve is also here. Is a good shot of the vagus nerve. We've seen this quite a bit already within the carotid sheath. descends down. It's going to come down and loop on the left side. It's going to loop around the arch of the aorta and then come back right next to the trachea as it comes up into the recurrent laryngeal. On the right side, it comes down, loops around the subclavian artery, and then comes up the right next to the trachea, coming up as the right recurrent laryngeal nerve. The vagus nerve obviously continues down then towards that esophageal plexus within the thoracic cavity. And we've already studied that prior to this lecture. Okay, on the back side today, what I'd like you to do on the thyroid gland, we're not going to be able to see this beautiful posterior view necessarily, but I want you to find these parathyroid glands. Okay, these are found on the back of the thyroid gland, tiny pea-shaped structures here. So what you can do is kind of lift, kind of take a probe or your gloved hand and lift that thyroid back around in today's dissection to reveal one side of these parathyroid glands on the back side. Okay. Okay, now at the root, now get your orientation here. We're looking from the back side. So this is the right and this is the left. Here's the arch of the aorta. We have the common carotids coming up here. The internal jugulars here and here. External jugulars are not shown, but here off of the arch of the aorta, the first branch is that brachiocephalic. Again, we're looking from the back side now. That might be confusing. Usually when you look at the arch of the aorta, you've looked at it from the anterior view. This is a posterior view. The arch of the brachiocephalic is then going to branch off into the right common carotid and right subclavian. And then on the left side, as the arch continues, it goes into the left common carotid, and then the next branch off the arch of the aorta is going to be the left subclavian. So again, subclavian, here's your vertebral arteries, the first branch off. Here's your thyrocervical trunk right here. Here's ascending ascending cervical, and here is inferior thyroid, transverse cervical, suprascapular. Hopefully this is all fairly review at this point, but just another nice view from that angle. Okay, let's look at the internal jugular vein here. Here, again, the internal jugular is going to receive blood from the face as well as other things here, but it's going to come, will receive from the retromandibular vein right here as it comes down, as well as the facial vein. It's also going to receive blood from the occipital vein, from the superior and middle thyroid veins coming in from the superior and middle thyroid veins coming from the thyroid gland. It's also, let's see here, the external jugular, let's talk about that for a second, is going to be here, and it's cut, so you can see where it would be, over the top of the sternocleidomastoid muscle. Here's the external jugular, and then it would drain down into here. The external jugular is going to drain the retromandibular vein, some of that at least, coming down here. It's also going to drain some of the posterior auricular vein right here, coming down. Outside of the sternocleidomastoid, and that's going to drain, actually, you can see directly into the subclavian vein right there. So next to the internal jugular, but it's kind of lateral to that. It's right going to go into the into the subclavian vein right there. Now, a different shot here, if I show you this, here you can see the internal jugular. Here you can see where the external jugular would drain as well. Also into the subclavian vein are going to be the thoracic duct. These are going to be lymphatic drainage. The thoracic duct comes on the left side right at this kind of bifurcation. Well, it's kind of the junction of the internal jugular to the subclavian vein. That's right where the thoracic duct is going to drain. On the right side, you have a right lymphatic duct. I'm going to drain there on the right side as well. And here's where the subclavian vein, here's the external jugular joining the subclavian vein, and right where the internal jugular meets the subclavian, it changes its name to the brachiocephalic vein. On the right side, here's internal jugular on the left, joining the subclavian vein on the left, and then right there becomes the brachiocephalic vein on the left. Both of those join into the superior vena cava, which is one of the three vessels entering the right atria. So hopefully that is a good review, but we haven't really talked about the brachiocephalic veins a lot, but that's right where they are there. Okay, now let's just go back to the thyrocervical trunk. I know this is repetition, but repetition helps in learning, hopefully here. So the first branch off of the subclavian artery is the vertebral artery, coming up through the transverse processes, going up into the circle of Willis. The second branch is the thyrocervical trunk. So again, suprascapular artery coming down here, traveling through the suprascapular notch to the posterior scapular musculature, the posterior rotator cuff, as well as teres major coming back this way. Transverse cervical artery here is going to join with the cranial nerve number 11, the spinal accessory nerve, to ultimately innervate sternocleidomastoid and trapezius. Here you have the ascending cervical artery coming up, and then the inferior thyroid, not really shown there. Here's a better shot of it. Here, suprascapular, transverse cervical, ascending cervical, and then inferior thyroid coming here. Well, we've seen the inferior thyroid going to the thyroid. Coming off of, you can see it's in, all of these are really in front of them. Here's that anterior scalene. They're all really in front of that. And you know that the phrenic nerve sits right on top of the anterior scalene as well. Remember here that the brachioplexus and the subclavian artery travel behind the anterior scalene, between the middle scalene, whereas the subclavian vein is going to be on the outside of that. Travels in front of the anterior scalene. Ansa cervicalis coming off of the cervical spine, higher up in the cervical spine, as well as the hypoglossal nerve is going to come down. Here's hypoglossal coming down into the tongue. Here's a better shot of that. Hypoglossal coming in here through that hypoglossal canal, ansa cervicalis coming towards the front to supply these strap muscles. Remember the strap muscles coming to the hyoid. Let's look at the skull for a second. Just review a little bit of the skull. The mastoid process, the temporal bone back here. Here's the styloid process of the temporal bone. Right here, the external auditory meatus or acoustic meatus there. The stylohyoid muscle, remember, is coming off of the styloid going to the hyoid. The mastoid coming back here is that posterior belly of the digastric, also the sternocleidomastoid. Remember all of this. The foramen ovale, that's going to be an important structure that we'll see. This is medial to the mandibular fossa, here where the condylar, you can see here's the mandibular fossa where the condylar process of the mandible attaches or sits to make the TMJ. The parotid gland, here's a different shot here of the parotid gland. Remember we talked before, this is going to be difficult to tell the difference between glandular tissue and adipose tissue here, but this is going to be over the top of the masseter muscle. Everybody though should be able to see today their parotid duct as it comes. That should be obvious in each dissection coming this way. And that's going to enter through the masseter muscle and then dive into the oral cavity here, just lateral to the upper molars. So this is going to be a place where saliva is constantly being dumped. That's going to be a place where easy plaque collection is. This is your dentist's favorite spot to scrape plaque off of the upper molars back there from that parotid gland. In this picture, what I want to show though too is the facial nerve. Now, the facial nerve mostly comes out of the stylomastoid frame and just behind the external acoustic meatus, between the styloid process and the mastoid process. And it's going to exit through here. This is going to give a few branches. It's going to go back to the occipital area behind the ear. It's also going to give some temporal branches up on top, some temporal branches towards the temporal region, but then it's going to also give a bunch of branches coming off onto the face, the facial nerve. It's going to give a temporal branch. It's going to give some zygomatic branches here. You can see the zygomatic branch. It's going to give buccal branches, and then a marginal mandibular branch. Remember all these from the facial? And then cervical branches coming down onto the neck, onto the anterior portion of the neck. This is a primarily motor nerve for facial, to muscles to give facial expression. It's also going to give a, let me see if I can find maybe a different shot here. Here's a, here's the occipital coming back on the backside from the facial. Different shot here, but on the other, just a different picture here. This is going to give a couple different branches of the mandibular division of cranial nerve number 5. There's the auriculotemporal branch coming up right in front of the ear, looping in front of the ear, coming up to the side of the head, and then a buccal branch here of the trigeminal, again of the mandibular branch V3 of the trigeminal nerve. This is going to be easily confused. This buccal branch of trigeminal is going to be easily confused with the buccal branch from the facial nerve. Now, one way to be able to tell the difference here is, does it come from the parotid gland or does it come from underneath the masseter muscle? So if it comes from underneath the masseter muscle, you know that that's going to be the mandibular division of cranial nerve number 5, the buccal branch of the mandibular division. If it comes from superficial to the masseter, if it's coming out of the kind of out of the parotid, it's going to be a buccal branch of the facial nerve. So a couple nerves here that are a little deep. One's deep, one's superficial, but they both innervate that same kind of area in there. Okay, now this area underneath the jaw, again, just a review of that retromandibular vein that you should be able to identify here. This is going to be behind the ramus of the mandible. It's going to help drain that plexus of veins on the side of the face, in front of the pterygopalatine fossa, which sits right up in here, where the mandibular division of 5 will exit. And this is primarily going to exit into the internal jugular vein, but also will help drain the posterior auricular vein into the external jugular vein here, coming on the anterior, on the outside of the sternocleidomastoid. Now, today, like we said, we will be removing the mandible to do this. Now, one of the things I want you to see, let's go to the skull here, is just be mindful of the temporalis muscle. Now, the temporalis, remember, it has its origin, a broad origin on these superior and inferior temporal lines of the, primarily the, oh boy, my goodness, why did I just forget the parietal bone? Oh my goodness, right here. So the frontal bone, the parietal bone, it's primarily going to get its origin way up here on these inferior and superior temporal lines. It's going to travel underneath the zygomatic arch and attach to the coronoid process of the mandible. Okay. Now we're going to be cutting that off, so you can take some nippers and just cut off the coronoid process of the mandible, and that will free. It's not really a point insertion. It's kind of a, it's maybe a little broader insertion here, but you can cut that off, and that will free up the temporalis insertion. So we won't have to worry about that. Now, I either want you to dislocate the TMJ from the condylar process of the mandible, or you can take a saw, a tiny hacksaw, and just cut the neck of that condylar process off. So you can cut through that to get the mandible out here. So we can dislocate that part of that side of the jaw. And what you're going to do then is cut through the masseter. Okay, you're going to cut through the masseter muscle so that you can get to the mandible itself. And what you'll do is find, with a smaller hacksaw, You'll have to use a hacksaw first. You can't just use a nippers to cut through the mandible here. You'll have to saw through it, but you can use a hacksaw and then maybe a nippers a little bit later. And we're going to make a horizontal cut through the mandible at about the level of the lower teeth, right through here. If I come to a different shot here, you've kind of nipped that coronoid process off and gotten rid of the temporalis insertion. You've either cut through the condylar portion or just kind of dislocated that, depending on how easy or difficult that is. I would maybe suggest just cutting through the mandible so you can take it completely off of its proximal attachments, and then kind of at that lower jaw, right through here on the underside. Oops, sorry about that. There you go. On the underside, you can kind of see. I'd like you to get kind of underneath this mandibular foramen, so right through here as it comes through, cutting that off. So and then we'll be able to see underneath here. We'll be able to see the pterygopalatine fossa right up and underneath here. Now they've dissected, they've cut off of the zygomatic arch. I don't think we need to do that in this dissection. We'll just kind of be able to look more underneath it. On the inside of the, we'll be kind of able to see underneath there. So underneath here though, we should be able to see where that inferior alveolar artery and nerve are coming in to the mandibular fossa together. To supply the lower jaw as it comes down. Remember, this is right where that comes down into here. This is where when you go to the dentist and they, if you're getting work done on your lower jaw or your lower teeth, they'll inject some numbing agent into the nerve here. They're coming back on the back side. You can kind of feel with your tongue too, coming back here, and they're putting some numbing agent onto the nerve, this inferior alveolar nerve, entering the inferior alveolar foramen. And then that's going to come around and then exit the mental foramen here as the mental nerve as it comes down. So that'll help numb that branch of cranial nerve number 5. We'll also be looking at the skull here. We'll see the pterygopalatine fossa coming up into here, where the cranial nerve number 5 will exit through the foramen ovale, just behind the lateral pterygoid process. We'll be looking at those branches in just a couple of minutes. And also the stylomastoid foramen, kind of between the styloid process and the mastoid process, where the exit of cranial nerve number 7, the facial nerve, will exit. We'll be able to see some of that. Okay, let's finish up today with just a couple of slides looking at the mandibular division of 5, cranial nerve number 5, as it exits out the foramen ovale through the pterygopalatine fossa. The first branch here, the mesenteric going to the masseter. You can see it kind of branching right off here, going to the masseter, which has been removed. And again, we'll be able to see all this now that we've removed the mandible, or the ramus of the mandible at least, coming down this way. Okay, so the mesenteric muscle nerve coming to the masseter there. There's also a lateral pterygoid nerve coming to the lateral pterygoid muscle there. There's a buccal nerve coming down here, which is going to go under the masseter muscle to the buccinator muscle, right here. That muscle sucking, used for sucking and producing negative pressure. And then coming off of that, here's your lingual nerve that we've seen already. A little bit, we touched on this in the first couple slides. The lingual nerve is obviously going towards the tongue, but it's also, there's a really important nerve coming off the back side here called joining the lingual nerve. This is actually a nerve off of the facial nerve. Here's maybe a better way to see this. Here's the facial nerve exiting the stylomastoid foramen right here. Most of the facial nerve is going to exit here, but then there's this branch of it that goes around that ear, through the kind of around that tympanic membrane of the ear, and then joins with the lingual nerve of trigeminal here. So that's going to be the chorda tympani. Now, what's interesting about this is what allows the tongue to have its sensation from the anterior 2/3 of the tongue. This provides sensation there, but it allows the facial nerve to be a mixed nerve. Remember, the facial nerve is basically going to be for muscles of facial expression, but it's also going to give this sensory nerve joining with the lingual nerve from the mandibular branch of 5 to the anterior 2/3 of the tongue. So that the chorda tympani is this bridge between facial, exiting a little bit differently here. That's going to exit the petrotympanic fissure to join with lingual, versus the rest of the facial usually exits the stylomastoid foramen. Okay, that's interesting. And then the inferior alveolar coming back up here, it's been cut. That's going to come down here, and then a branch of that is going to come down. Remember, the nerve to the mylohyoid is going to give innervation to the mylohyoid muscle and the anterior belly of the digastric. But that inferior alveolar is going to continue down and enter into the mandibular foramen along with the inferior alveolar artery as it comes to supply the lower jaw and teeth. Okay. And then off of here as well, here's the posterior auricular. We've seen that on a different slide already there. Posterior auricular nerve loops in front of the ear onto the scalp. Then you've also got a couple of deep temporal branches up here to supply the temporalis muscle up on top here. Okay. Now the last slide we'll touch on is I promised we'd talk about the branches of the maxillary artery. So remember, here's the facial artery coming down and then continuing up that external carotid. Here's the mandibular, the maxillary division or branch, and then it continues up into the superficial temporal. Remember those? Now that we've removed the jaw, we can now look at this maxillary branch, the maxillary artery off of the external carotid. So you have an inferior alveolar artery here. The inferior alveolar artery is going to be right here, the first branch off of the maxillary. This is going to actually join with the inferior alveolar nerve into that mandibular foramen. Here you have the mesenteric artery coming into the masseter, just in front of that. Okay, then you got a couple of deep temporal arteries coming up onto the temporalis muscle. Here's a middle meningeal artery. Remember, that one's going to come in through the, it ascends up through that foramen spinosum on the bottom of the skull and ascends on the inside of the cranium. It's the largest of the cranial arteries coming up this way. Here you have the superior alveolar arteries. Here's, I think this is a better shot of that here coming off. Here's the deep temporals. Here's the superior alveolar artery supplying the upper jaw of the maxilla. And then coming off of that is the infraorbital artery. Remember, this enters the infraorbital fissure, travels on the bottom of the orbit, and exits in the infraorbital foramina to supply some of the cheek on the front side there. And then you also have this sphenopalatine. Here's a better shot of that coming up this way. The sphenopalatine artery coming back up into the pterygopalatine fossa supplies much of the posterior aspect of the nasal cavity, kind of the terminal branch of the maxillary artery here. But then also one that ducks down the descending palatine arteries. This is going to travel down between the pterygoid process of the sphenoid, the pterygoid process of the sphenoid bone and the palatine bone, coming right down here, and then come out on the roof of the mouth as the greater and lesser palatine arteries. So they come up here. We'll look at those when we bisect the head in a future dissection. Those are the branches of the maxillary artery. Hopefully that was helpful to see. Okay, that's enough of me for the day. I hope that was helpful. Hopefully you learned something with this information today. Good to remove that ramus. It really exposes a lot of material. So hopefully that was helpful, and I will look forward to seeing you in lab. Thanks for your time. Have a great day.